Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. Welcome to Monday Health Minutes with Valley Health. So many people have the goal of losing weight. There's the diet and exercise route, but there's also so many medications out there that can assist you in your weight loss journey. So what should you consider? What are the pros and the cons? We're talking with Dr. Michael Amos about that today. He's board certified in obesity management. So thanks for being here.
Thanks for having me.
So many things to consider. Let's talk about which one has the best results. Everyone has tried diet and exercise.
Yes.
But losing weight is very difficult. And now all of these medicines are around that can assist. What are the statistics showing?
Where do we fall out? And so diet and exercise, I think everybody should realize that that's the bedrock, right? So we want to make lifestyle changes that promote healthy eating, making sure that we're staying active. And to get kind of some numbers to these things, those as the bedrock get you about 5% weight loss. In studies that have studied just changing the diet and adding some exercise, you can get 5% of your body weight loss. Then we start talking about medications. And with the newer drugs such as Wegovy or Zepbound, we're seeing numbers up to 25 to 30% of total body weight loss based on diet, exercise, plus the medications. And so we have a lot of different options that can come into play, but we have to start with trying to make some changes.
Yeah, lifestyle is always the bedrock, as you said. What are some of the side effects? I mean, diet and exercise, it's hard. It's
Yes.
hard to keep it going. What are some of the side effects that can accompany some of these weight loss medications?
So weight loss medications in particular, you start to think about things like fast heart rate, people feeling palpitations in their chest because their heart's racing. They can even get a little bit hot, sweaty, bothered in that way. You also then start to talk about the even more effective agents, a lot of GI side effects, nausea, vomiting, constipation. A lot of the times we even get some folks that develop up to irritable bowel syndrome with constipation because of these medications. So it's all on a spectrum, and I encourage folks to definitely give it a shot. I don't think that the side effect profile is something that should worry a lot of folks, because studies have also studied, well, what happens if we stop the drugs? And more cases than not, the studies show that when you stop the drug, the side effects go away.
Are the medications that can assist you, are they lifelong? Are they interim? Should you plan on taking them for how long?
That's a very good question. And so it's actually a question that we're studying closely in obesity medicine, because we want to see, is there a point where the body resets? So I'll explain a little bit about a reset. We think that right now the body has a set point, if you will, a place where it wants to keep your weight because of
it's happy.
Stress. Yes, you know, it wants to have resources available at that weight. And so this point we find should be able to be changed. We are currently out though with studies 2-3 years looking at folks on the drugs and seeing if we are able to adjust the dose downward and still stay stable at the weight that we have gotten them to. There are early studies of 1 to 2 years do show if we stop the drug that the weight will come back. Usually not to the peak of where somebody was, but you do probably get, if you've lost 25, you'll probably come back 15 to 20% back up. And so it's a little bit of a wait and see kind of game to see how long exactly with the newer agents we will have to be on them to really maintain that new body weight.
Right. And then, of course, there is the qualifying for it for insurance and the money cost, and that's significant.
Yes. I deal with this in my practice all day, every day, some days. It has become a big insurance game to see where we really can most effectively help people. Some insurances, private insurances in particular, like the new weight loss drugs, and will pay for them. Public insurance has not yet picked up on that. But those are the newest agents. Older agents are available, and there's also cash prices for some of the newer agents, such as Saxenda. Adipex is also on that list, that the cash price is usually fairly manageable for folks.
Throw out a number.
Oh, $50.
$50 a month, but some of the newer agents could be up to $1,500 a month. So it's definitely a conversation you need to have with your doctor and with your insurance company.
Oh, yes.
All right. Some great information, something everyone thinks about. You know, how do I make this easier? And it's a possibility. Definitely a topic of conversation. Dr. Amos, thank you.
Thank you.
Thanks for checking in for Monday Health Minutes.